nonprofit thank you. A nonprofit organization working to advance menstrual health, recognizing that local leaders are best positioned to drive lasting change. We train and support social entrepreneurs, volunteers, and partners to address multiple facets of menstrual health, from manufacturing washable pads, providing menstrual health education, and advocating to improve menstrual health policies and programming. On behalf of the Reproductive Health Supplies Coalition, Menstrual Health Supplies Workstream, Bfree Cup, and Days for Girls, we extend a very warm welcome to each of you and a very big thank you up front to our esteemed speakers and panelists. Before we move on, I want to discuss how we'll be interacting today. If you're in the audience, you will be muted during the webinar. If you have a question, please put it in the Q&A box. The end of the webinar, we're dedicated to answering as many questions as we can get to, so please be sure to do that. Please also put right now in the chat box your name, your country, your organization that you're affiliated with, so we can get a sense of who our community is. And then we're really excited, excuse me, that we'll be using an AI live translation feature called Wordly. And to access this, you have two options, and you'll see this on our screen in 1 second. If you would like to view Wordly translation from your phone, you can scan that QR code right there using your phone's camera and then follow along in the browser. If you'd like to use Wordly via your web browser, then type in the URL displayed right there on the screen, or click the link provided via the Zoom chat that Sarah will put in, and she's done before. From there, you can select your preferred translation language and then read the captions in your language of choice. If you have any questions or issues getting Wordly to work, please just send a direct message to Sarah Webb at the Reproductive Health Supplies Coalition, and she can help you with assistance. So with that, we will get started. And again, as we're going, please put your questions in. If you have one directed specifically to one of our speakers, please add their name to that. So as you know, tomorrow is March 8th, and the world will be celebrating International Women's Day. And the theme selected for 2024 is Invest in Women, Accelerate Progress, which focuses on issues around the growing gender inequalities that exist and that are becoming more and more evident, with women and girls being left behind. This year's theme was a perfect lead-in into this webinar, and we're really excited for our discussion today to shine a light on Canada's journey to accelerate gender and menstrual equality, both domestically and internationally. I wanted to let you know the flow of our webinar. It will be divided into 5 parts. The first part will have opening remarks, and then we'll move to some presentations where we're going to learn more about the menstrual health efforts that are being done globally and domestically. We'll then go to a panel discussion where we'll get insights into how accelerating access to menstrual and gender equality has been happening within Canada. And then we'll turn to a section on what happens next. What are some actionable paths towards menstrual and gender equality that we can take away from learning what Canada's been doing? We'll have some closing remarks next, and then we hope to have a really nice chunk of time that we can answer your questions. So please, throughout, put your Q&A in the chat box. As you noticed from our invite, we have many amazing experts today that are joining us to help us understand more about Canada's journey. We want to make sure that every one of our presenters has time to share their remarks. So if it looks like a presenter might be exceeding their allotted time, please know I'm going to come in and give a 30-second warning, not to be rude, but we just want to make sure everybody has time to share what they've prepared. So with that, we will go into our opening remarks, and I'm really excited to introduce you to Tanya Mahajan, who will be giving these remarks. Tanya leads the international programs portfolio for the PAD project, and she's the co-founder of Menstrual Health Action for Impact. She has over 14 years experience in addressing systemic barriers to market-related health products and services for menstrual health in India and globally. She also co-chairs the Menstrual Health Workstream at the Reproductive Health Supplies Coalition. So Tanya, I'll turn the time over to you.
Thank you so much, Diana, and thanks for the opportunity to present my opening remarks for this incredible discussion. The world has started to recognize the intersectional nature of menstrual health and how pivotal it is towards achieving outcomes related to the health and well-being of those who menstruate across the reproductive life course. Menstrual health is a gateway to conversations that can improve health seeking related to SRH issues. It's interconnected with adoption of hormonal and fertility awareness-based family planning, and it's closely linked with experiences of gender-based violence. And the last decade, particularly, has seen critical market shaping work in the form of support to upstream product innovations in both single use and multiple use product categories. The Canadian government has played a pivotal role by not only providing some of these early stage catalytic investments, but also playing the role of an aggregator for other donors and organizations, whether it's the UN, private foundations, governments, through its funding mechanisms like the Grand Challenges. As a result of this, we've seen investments in research and development for various products, including alternative fibers for single-use pads, compostable raw materials as alternatives to plastics, textiles for washable products, silicone-based insertable products, including cups and discs. And many of these names like Bfree cups, Huru, Zena Africa, Afri pads, Aka, She pads, Beagle, Sati, Saral. These are some names we all know very well in the menstrual product innovation landscape, and they've all been supported through early stage Canadian efforts. The only instance where at least I personally have seen a large MNC come in and provide technical support to a startup at a product and process R&D level is where J&J came in along with these investments to provide technical assistance to ShePads. So that speaks to the power of aggregation that Canada has brought into this effort. Well, some of these enterprises have been homegrown within Canada. Many are from LMICs, low and middle income countries, and are shaping markets for menstrual products in South Asia and Africa. Canada had the foresight at that point to not just fund these upstream efforts, but also look at downstream interventions to enhance access to information at the last mile within LMIC settings. They invested in innovations for behavior change communication at the last mile. Some examples are through Eyes, Pan Kale, it was a comic book around menstruation, even a manual spinner for washing washable pads, a period fellowship run by Sukhi Bhava to create resources for training. All of these contributing to last mile efforts for creating better information around menstrual health. So we take this opportunity today through these discussions to not only celebrate the catalytic role that Canada has played in shaping menstrual product innovations, but learn from their experiences to guide future investments by others. And menstrual health started, as with most international donor efforts, with a wash lens, and slowly developed into focused efforts for menstrual products. We'll also hear about how Canada is re-envisioning its strategy with a more intersectional approach under larger reproductive health and gender-based violence portfolios. We'll also hear from Canadian social entrepreneurs who are an active part of this landscape, but have worked tirelessly behind the scenes for bringing this advocacy work to fruition. That's it from me. Over to you, Diana.
Thank you so much, Tanya, for sharing that. That was the perfect opening remarks. As you said, Canada has really set the standard on helping not just with array of products, but information, education, financing, and really looking both within their country and outside. So thank you so much. And I'm so excited we get to delve into this. And so now we'll focus on these efforts and go a little bit deeper into what they've been doing. And so I'm really excited to introduce you to this part of our discussion. I'm going to introduce our speakers. The first will be Christina McIsaac, who serves as the Director of Innovation for the Fund for Innovation and Transformation, and that the acronym is FIT. And before FIT, she worked in strategic community investment with a global financial services company, engaged with the charitable sector across Canada and on a range of issues. And she was a past participant of Canada World Youth. We also have Haley Newman-Patrician, who has been involved in the menstrual equity space since 2018. And she currently helps run Monthly Dignity, a Montreal-based nonprofit addressing period poverty through distribution, education, and advocacy. In addition, Haley serves as a project coordinator for Free Periods Canada. And then finally, we'll get to hear from Joanna Baker, who has been the Senior Director General responsible for the Programs and Regional Operations Branch at Women and Gender Equality Canada, also known as WAGE, since August 2020. Under her leadership, her teams address systemic barriers to gender equality and support the capacity and sustainability of women's equality. Joanna has 20 years experience working in various departments in the Canadian federal government. So with that, I'm going to turn the time over to Christina to talk about the work that Canada has been doing globally. Over to you, Christina.
Thank you, Diana, and thank you for the opportunity to be here today. I am pleased to be here today on behalf of FIT, the Fund for Innovation and Transformation, to highlight how a program like ours can support menstrual health equity and advocacy. So I'd first just like to acknowledge that the land I'm joining from is the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the national homeland of the Red River Métis, Treaty 1 territory, also known as Winnipeg, Canada. So for those of you that aren't familiar, FIT is a Canadian innovation grant and knowledge sharing program. We're funded by Global Affairs Canada and are a program of the Inter-Council Network of Provincial and Regional Councils for International Cooperation. And our aim is to support small and medium-sized organizations and their partners in the Global South to test innovative solutions to advance gender equality. So we provide grants of $150,000 to $250,000 to organizations that represent civil society, post-secondary institutions, for-profit, and social enterprises. And testing projects occur within a short 6 to 15-month timeframe. So now in our 5th year, close to $11 million has been distributed to testing projects in 33 countries spanning Africa, Latin America, Asia, and the Middle East. And over 50 solutions or innovative solutions were tested to address a range of contexts and a range of needs, from technologies and approaches to improve health outcomes, to climate smart and gender sensitive agriculture practices, educational approaches, and programs touching families and economic empowerment. The overall intention is to advance gender equality. So funded organizations are also encouraged to share their learnings and their results with the sector to foster a culture of collaboration. So FIT is guided by Canada's Feminist International Assistance Policy, or the FIAP, which recognizes that gender equality is not only a critical human right issue, but also the basis for inclusive and sustainable development. And so with our program's general flexibility, we've also supported testing projects that focus on menstrual health and hygiene challenges and stigma. And the innovators' approaches were very diverse, sustainable, and impressive. So I'd like to highlight 3 of them in communities in Uganda and Malawi, areas where many girls do not have access to menstrual products. And this reality leads to increased school absenteeism or dropout rates for girls and makes them very vulnerable to exploitation. So the first example is Girls of Tomorrow Foundation, who with their partner St. Jude Family Projects tested permaculture gardens as a unique and effective way to address menstrual stigma in Uganda. So local experts taught permaculture to participants through a female lens to address girls' menstrual health and hygiene needs. Each crop planted was tied to lessons focused on female health, anatomy, and experience. Girls and boys learned how to create reusable menstrual pads using banana fiber grown in the gardens. And this provided a sustainable and empowering way for women and girls to access supplies. And it also challenged the narrative that menstrual supplies should be hidden. So this innovation was able to improve 3 facets for girls. First, their psychological health by increasing self-esteem and confidence, their physical health by increasing nutrition, and then school attendance and social participation, which helps them to participate equally in society. So a second example is the social enterprise Women's Global Health Innovations. They developed the Bfree cup, an antibacterial menstrual cup that does not need to be washed or boiled between cycles. And it can also be left in place for up to 12 hours, which is a major benefit for girls in schools where sanitation facilities may not be available. With education and economic empowerment in mind, Women's Global Health Innovations and their partner, Public Health Ambassadors Uganda, worked with village health teams and used the innovative menstrual cup as an entry point to teach about menstrual health and hygiene management, as well as creating a new business model. So sales champions were trained as menstrual health and hygiene educators and as micro entrepreneurs who would then sell innovative Bfree cup products. By N-line, champions had reached close to 1,500 girls and women with more knowledge on menstrual health management, and they were also able to increase their incomes from the cup sales. And also by encouraging men and cultural and religious leaders, there was a reported change in attitude towards menstruation. So the Canadian Physicians for Aid and Relief is a third example. In Malawi, with their partner Freedom for Fistula, they look to help schoolgirls manage their menstrual health and then reduce absenteeism and improve educational outcomes. So testing the effectiveness of menstrual cups and reusable pads, this solution included girls from the time they began their periods, so a younger cohort than they traditionally worked with. And the aim was to give them tools they need to manage their menstrual hygiene, along with integrated, holistic educational programming, which involved the entire community, something they had never done before. So as a result, parental support for girls to continue schooling jumped from 8 to 64%. School absenteeism rates dropped significantly for girls, and the holistic approach led to an entire community advocating for improved wash facilities in the schools. And in addition, this particular organization partnered with Women's Global Health Innovations using their Bfree cups as part of their work. So while all three examples incorporated unique and innovative approaches and products, they did all address menstrual health challenges in their respective contexts and with that local lens. Each prioritized sustainable solutions and emphasized the importance of knowledge sharing to encourage community-led advocacy. So from the FIT pilot, we've learned that Canadian small and medium-sized organizations and their partners in the Global South can demonstrate very meaningful results and learnings through innovative approaches to advance gender equality. Their ideas and results can feed into a larger ecosystem of international cooperation, both in Canada and internationally, which we think is a very exciting outcome. So now I guess we could just hear from some of our innovators directly on the impact of innovation and what they've learned. So we have a short video to play. Thank you very much.
I think
once. Oh, sorry. I was going to say just 1 second. I can get that pulled up.
Okay. Because I was going to say, if you want, I could go ahead and go to a question and we could share the video to share in the resources. What do you think, Sarah?
Sure. Yeah, that sounds great. Thanks, Diana.
Okay. Oh, Christina, first of all, thank you. Like, I feel like I could listen to you all day with these different projects. It's really exciting to see and hear about the work that you're doing. I wanted to ask you, I love the innovation and the title of the FIT, is into innovation. I wanted to ask, what is the critical role that product innovation plays? And how have the social enterprises that you've worked with through this program accelerated access to menstrual health and menstrual equity in the work that you and the goals that you have for FIT? Could you speak to that for just a minute?
Yeah, sure. I mean, I think when we think about product, we're also thinking about other things, not necessarily a tangible product. But in all of these examples, the way they innovated or experimented was very unique to the context. And also they had sustainability in mind when they were testing products or innovation products. So I think your question about what role does it play? Like, I think innovation can be really critical. And in this particular, or in the case of our fund, and what we're seeing is that the organizations, both from Canada and from in international countries, they're looking at things from a very localized point of view, and they're trying out ideas that could have bigger impacts if they make sense. So when they learn if the ideas are making sense, these innovations can then have an influence on maybe being expanded to other communities or maybe picked up by other larger organizations who can implement them to a larger scale. So I hope I've answered your question, but I think the product innovation or whatever product means can be very, very impactful and important for the larger ecosystem to, it plays a huge role in that, so.
Thank you. And thank you, answered it. And I also think, I love that you work with the social enterprises, right, in the country.
Mhm.
The locally led, they know what's needed. They know the resources that they have. Like that first example you shared with the banana fibers in the garden. So really appreciate that you can take the creativity and the innovation, combine it with support and for the local leaders and what they know would be best in their environment, and hopefully see that scale up, right? Wow. Thank you. Thank you so much for that. I'm sure you'll have many questions at the end, but thank you so much. So we're going to move on now, and I'm really excited to announce today that we have a new advocacy resource that we can share with everyone. It's a menstrual health country snapshot on Canada. To discuss more about this, I'm going to turn the time over to Haley, who was one of the authors of this. So Haley, could you share with us more about Canada's menstrual health country snapshot?
Yeah, absolutely. Thank you so much. Hi, everyone. I'm thrilled to be here today. I'm calling in from the land where I grew up. Mississauga is part of the treaty and traditional territory of the Mississaugas of the Credit First Nations, the Haudenosaunee Confederacy, the Huron-Wendat, and the Wyandot Nations. This is land that I grew up on, played on, and learned on, and the first place I ever called home. And my family and I owe a great amount to this land and to the ongoing push for reconciliation and decolonization, and something that is an extremely important part of the conversation to have when we talk about menstrual health in the Canadian context. So Lisa Smith and I are really excited to be launching Canada's Menstrual Health Snapshot in partnership with Days for Girls today. What was long called menstrual hygiene management has been a growing cause in the international aid and development space for well over a decade, with a lot of attention being drawn to the gendered impacts of poverty and LMICs. And the particular ways that this affects people who menstruate. And like many Western countries, Canada has been a contributor to these initiatives abroad for a long time, but it wasn't until quite recently that, at least on a broad scale, Canadians began to turn inwards and think about the ways that menstrual health needs might also be going unmet within our own borders. Canada's Menstrual Health Snapshot provides an accessible overview of the menstrual health equity context in Canada and adds to a rich and growing set of similar documents from other countries. It is also the first snapshot from the so-called Global North, and it is crucial to consider period poverty and stigma in Canada alongside the context of countries who receive foreign aid in the form of menstrual hygiene products and program funding, so that we don't forget that Canada has more than its fair share of flaws and inequities in menstrual health. And to neglect to acknowledge this is nothing short of hypocritical. Creating the snapshot was an exciting privilege. We had a chance to zoom out and gain perspective on how quickly the menstrual equity movement in Canada has grown, thanks to the tireless efforts of grassroots activists across the country. In the past few years, numerous policies and programs have been implemented within individual workplaces, across school boards, within municipalities, at the provincial level, and most recently at the federal government level. But still, we have a really long way to go. More than 80% of Quebec-based students and employees don't have access to menstrual products at their educational institution or workplace. And we know that upwards of 22% of Canadians struggle to afford menstrual products on a regular basis. So the disparity between need and access is clear and is especially troubling against the backdrop of the current socioeconomic context in Canada. Canada's houseless population has been consistently growing. Food banks are experiencing the highest levels of demand in their recorded history. The number of children experiencing poverty continues to rise, and Northern Indigenous communities continue to face exorbitant period poverty and ongoing drinking water advisories. So for us, this snapshot highlights the incredible and exciting progress Canada has made towards menstrual equity, while also still acknowledging the extent of the work that there is still to be done and the major gaps we still have in data. So hopefully it can serve as a marker of hope and a reminder of our wins and inspire the continuation of this work. Thank you.
Thank you, Haley. And I just again want to thank the team that worked on that. Dr. Lisa Smith, she'll be on our panel. I think they've worked on that over a year. We've been going back and forth with them and just really appreciate that. And I think, as she said, it's really neat to kind of stop and take stock on what's happened in Canada, and then also identify what needs to still happen to get to where we hope to be with menstrual equality. So this is a great segue into talking about the domestic work. The Canada Menstrual Health Snapshot focuses mainly on the domestic work that's happening. And so for this, we're so excited to have Joanna Baker here to talk about what's happening with the Menstrual Equity Fund. And so I'm going to turn the time over now to you, Joanna. Thank you.
Thank you so much, Diana. It is really amazing to be here and to be part of this bigger movement. And as Haley said, turning inward and looking at what it is we're doing in Canada specifically with regards to menstrual health. So as mentioned, I'm Joanna. I'm the Director General of the Program Branch with Women and Gender Equality Canada, also known as WAGE. And I too would like to begin by acknowledging that I'm currently working in Chelsea, Quebec, on the unceded territory of the Algonquin and Anishinaabe peoples. And I recognize that Algonquins are the traditional custodians and defenders of the Ottawa Rivershed, and I spend time playing as much as I possibly can on rivers, and I'm deeply, deeply grateful for that. I would also like to thank Days for Girls Canada for extending this opportunity for me to speak on the Menstrual Equity Fund National Pilot and the other menstrual equity initiatives being implemented by the Government of Canada. It is really a pleasure to share these groundbreaking moments with all of you as we strive towards a future in which women and gender diverse people who menstruate can easily access the period products of their choice in an environment free of shame or stigma. I'd like to give you a bit of a sense of how this all began for us as a department and the work that went into designing and launching the Menstrual Equity Fund National Pilot, or MEF, as we like to call it. The 2021 mandate letter for the Minister for Women and Gender Equality and Youth included the creation of the Menstrual Equity Fund. Then in 2022, the federal budget committed time-limited funding to set up a national pilot to address the barriers related to affordability and stigma that some Canadians face when accessing menstrual products. Given that this was a new area of work for the federal government and for WAGE, the department spent a good part of 2022 conducting research and engagement in order to better understand the menstrual equity landscape in Canada. This included talking to folks like you who are on the call today, the private sector, provinces and territories, and other federal departments, not-for-profit organizations, shelters, food banks, community organizations, and organizations serving the North. We learned a lot from these discussions, but there were really three main takeaways for us. First, there are many, many different stakeholders providing menstrual product support, but there is not a cohesive framework across the country, and organizations rely heavily on donations. Second, the choice in menstrual products and easy access is critical to enabling dignity. And third, and lastly, education and awareness activities are important for long-term results. We use these takeaways and other information gathered through our research and engagement to design a pilot that aims to reach those most in need. The selected approach to implement the pilot has been to work with one established national not-for-profit organization, that being Food Banks Canada, to do two things. First, to set approaches and test approaches to distributing free menstrual products to community organizations serving diverse, low-income populations in various locations across Canada. And the second is to partner with a small number of grassroots organizations across Canada that are already advancing menstrual equity to scale up education and awareness activities to inform Canadians about period poverty and reduce stigma around menstruation. After all that important lead up, the pilot began finally in September 2023, and the results, I'm happy to say, to date have been impressive. Food Banks Canada has established 392 pilot locations across the country as initial distribution points for menstrual products. They are working with local food banks and community organizations from every province and territory, as well as Nunavut and Labrador. And because those 392 pilot locations have links in their local communities, through the MEF pilot, period products are expected to reach an additional 600 smaller community organizations and an estimated 570,000 low-income individuals each month. As of today, more than 35 million menstrual products have been delivered, and Food Banks Canada estimates 60 million products will be distributed to pilot sites by March 31st, 2024. The work of Food Banks Canada is also supported by private sector partnerships. They've selected a handful of private companies to work with, like Always Tampax, Edgewell, Mackenzie Canada, Only, Joni, and Isle, to make products available to those in need, and a variety of products, as you note. We're also excited that Food Banks Canada is using MEF Pilot as a chance to test the uptake of reusable products. Currently, they are working with 2 sites in Ontario and 1 in British Columbia. For the education and awareness component of the pilot, Food Banks is working with 6 menstrual equity organizations to scale up education activities across much of Canada. In Ontario, there's Period Purse and Help a Girl Out. In BC, there's Free Periods Canada and Project AIM. In Quebec, there's Monthly Dignity, and Moontime Connections, formerly Moontime Sisters, has chapters in Saskatchewan, Ontario, Manitoba, and BC. And I just noted that they are absolutely on this call today. I think many of these partners are, which is wonderful. Food Banks Canada has also launched an excellent MEF website, which I encourage you to check out as it provides more specific pilot implementation details. The link to the website has been shared with you by the organizers, and if you're interested in taking a look, I really recommend it. But of course, that's not it happening on the domestic front. I also wanted to take time to mention that the MEF pilot is just one of 3 initiatives that the government is undertaking to address period poverty and advance towards menstrual equity in Canada. In addition, since 2021, Indigenous Services Canada has been providing ongoing funding to schools on reserve and in the north for menstrual products. Given Indigenous peoples are best placed to make decisions on supporting Indigenous students, this funding provides educational bodies with the flexibility to determine what kind of programming is delivered. The 3rd initiative is led by Employment and Social Development Canada. Starting in December 2023, the Canadian Labour Code regulation requires that all washroom facilities in federally regulated workplaces provide menstrual products. That includes bathrooms identified for men, for women, and for all genders. These regulations cover places like Parliament Hill, the workplaces of federal public servants, like the offices I work at Wage, as well as workplaces in sectors like rail, air, road, banking, postal, telecommunications. While there are many workplaces that are not federally regulated, obviously, we think this sends a strong signal that will help improve equity, reduce stigma, and encourage healthier, more inclusive workplaces. These initiatives and other federal activities related to menstrual equity are all outlined in a recently tabled response to the recommendations of a report by the Standing Committee on the Status of Women, and I would highly recommend that you read their 11 recommendations that talk about specific issues like the financial and geographic barriers that can limit access to period products. But the report also points out broad systemic issues and challenges related to menstrual equity, like the need for all gender washrooms, for access to clean water on reserve, as Haley mentioned, and for the elimination of the stigma and negative stereotypes surrounding menstruation. I'll end by noting that period poverty is an intersectional and complex issue. I don't need to tell this audience that, and the federal, provincial, territorial governments, municipalities, and community organizations all have a role to play. So thank you again for inviting me to speak at this event and for the amazing, important work that you all do for our community.
Oh, Joanna, thank you. I think that must have been very hard to take all the work you're doing down into that little bit of time, but it really does. It just barely gets our toes in the water on what you're doing. But one thing I wanted to point out before asking you a question is I really appreciate that the government is really looking at it holistically, like not just at one product, but product choice, education, wash facilities. We know menstrual health needs are so much more than just a product. So I really love that you have so many programs going to really address holistically those needs. I did have a question. As you stated in the beginning, in particular with MEF, this is currently a pilot. And I know you've got several other initiatives going. What do you see comes next? And then kind of on top of that, I would ask, how do we move investments to go from the pilot to actual sustained funding? If you could speak to that, please.
For sure, thank you. And it was amazing in the research and development phase to layer on all those complexities and realize that we needed a holistic approach. And it was a real acknowledgement that there was so much work already being done, and that the job perhaps was to knit it together, right? And so thank you for that comment, Diana. So yes, it's true. It is a pilot. And I can tell you that my team, who's on the implementation side, is laser focused on ensuring the success of that pilot with our partners, because as we know that it's time limited funding. So we feel a little bit like we're on borrowed time ourselves. However, what the pilot has been set up to do is that once it's completed, we will have a suite to go over of results and lessons learned along the way. And we're really excited to do that continued analysis of the menstrual equity landscape. And what we know is that the work we're investing in and having that laser focus on now in the pilot will help us build recommendations on what's next. What's next for addressing period poverty in Canada through a federal role, and that recommendation will be evidence-based. So although it's true, it's a short-term piece, we believe it's a building block to something bigger and more exciting. I think that, as per your question around sustained funding, we have incredible advocates on the case who work amongst us. As you know, I would encourage those voices to continue, as well as, again, us as federal government employees. We are well positioned once we've done this pilot to really put an evidence-based recommendation forward to the government for a long-term sustained piece. And I think the other player in this is the private sector. So I think it is really pertinent that we have partnered with the private sector and some really innovative, B Corp companies who are interested in making social change. And I believe their voice is going to be really important as we move through to a sustainability model for this pilot.
Joanna, I wish we could unpack this. I couldn't agree more that in my advocacy work, the success that I've seen for long-term sustainable change has come when public and private sector come together and both bring equal parts. And so I wanted to mention that before when you said that you'd been working with private sector in the pilots, because I do think that is the way to have sustained funding, right? And so thank you so much. I'm sure you'll have questions as we come to the Q&A. So I hope people are putting in their questions in the chat box. I know I have so many myself, but we're going to move along. So thank you so much, Joanna, for sharing that. I think really a credit to Canada. As you said, it is a pilot, but I love that you're getting the data, that it's evidence-based. It's really hard. Data speaks, and if data is showing something, it's really hard for people not to fund it. And so I love that you are getting the data, which is really a great segue to our next part, which is a panel discussion. And we're going to talk about insights into accelerating access to menstrual and gender equity, and really kind of focus on that data-driven, getting data to lead and advance this field. For our panel discussion, I'm happy to introduce you to three menstrual health advocates who have done a lot of work in Canada. The first one is Nikki Hill. She is a public affairs expert. She founded United Ways, British Columbia's Period Promise campaign in 2016 to address the growing issues around period poverty in the province. Period Promise and community partners successfully, I love this, advocated for the formation of a British Columbia period poverty task force to address the issue around period poverty through cross-sector collaboration. And Nikki was appointed to be the chief of the province in 2023. We also have Veronica Brown, who will be on our panel, and she is the Ontario Chapter Lead and Education Co-Director for the Moontime Connections, an Indigenous-led period equity organization in Canada. Veronica is an Indigenous knowledge professor at Sentinel College and not only advocates for Indigenous rights, but for the truth of colonization and the impact that's had on the Indigenous nations. And then our last panel member will be Dr. Lisa Smith, who is a member of the Department of Sociology and coordinator of the Menstrual Cycle Research Group at Douglas College. She's an active member of the menstrual equity activist community in Canada and internationally, and serves on a number of community action groups and societies related to menstruation. So what I'm going to do is ask each of you one question you'll have about 4 minutes to respond. It'll be a slightly different question for each of you. And then I will ask one question at the end, the same one to each of you. So Nikki, if it's okay, I'm going to start with you. I might have two questions in here, but what are the lessons we can learn from the work you did in British Columbia, like how you approached your data gathering, that other provinces and other advocates could learn to apply your insights. Because one of the things we found is sometimes we can have data, but we can't use it outside of the way it was gathered wasn't right. And so can you share some insights on how you ensured that at the provincial level, the data you gathered could be compared across provinces and still used in the national level data? So if you could speak to that, please.
Absolutely. Thank you. And really glad to be here. I'm still having my coffee. It's a little earlier for us BC folks, but I'm really happy that we could join this huge panel today as well and to my people. So I wanted to actually speak a little bit. I am the chair of the Government of BC Period Poverty Task Force now, and that's a huge honor I've had for the last 2 years, which is starting to wrap up, and I can touch on what our work is as well. But I want to go back to the way I got involved in this work was actually when I was working at United Way, and we brought in the Period Promise campaign. And I think data has always been so integral to our work because of that and how we started. And we started very much, as many of I know our Canadian partners on here, in 2016. We didn't have a lot of information. We could very clearly see we had a problem. We didn't necessarily know how to tell a story. So our data collection started because we wanted to do the advocacy to various levels of government, and we didn't have the information to actually get them to come with us to understand what the impact was in community, to talk really coherently about who was struggling to access menstrual supplies in our province and in our communities. And so we, I think partly because United Way is a very data-driven social policy organization, we did institute right away, as soon as we realized that we needed to continue on this path, that there was such a high need, to start to do surveys. And they weren't to the degree, I think, in which we could say that consistency. My academic friends on here would look at those surveys and say they're not, the way we should do it. So we did then expand into really formalizing that data collection piece. In 2019, I think we were, obviously really proud of the work that happened in 2019 to ensure that the BC government was one of the first to commit to menstrual products in the K-12 system, which is an ongoing journey to make sure it's implemented and consistent. But the little known piece that doesn't get highlighted very much, because it's the less appealing data part, is that they also equally funded a research project for us. So at the same time as they did the advocacy and partnered with Period Promise, they also partnered with Period Promise to do a pretty significant data collection. And that data collection, similarly to how we just heard about how Canada is now moving forward on the Menstrual Equity Fund, did involve grants to local organizations in which we had a very stringent process for them to be able to distribute supplies to the clients they served in nonprofits, but also deliver data back to us so that we could have a full story about what the problem was. And that data, I still, we released it in 2021. I use it all the time still. It is still very relevant. The stats constantly line up. And part of that data recommended that BC also set up a roundtable for more expert advice to really look at the systemic issues of period poverty and menstrual equity and how they address them. So that's where our task force came from. The task force included a second round of data-driven grants, which I think Dr. Smith will also speak to, as she's been really integral to that piece. But those data-driven grants have now been informing our task force work. Again, another round of nonprofits around BC, not the same ones. We need different data. And we needed data from certain populations we didn't have it on before. So a high focus on rural communities, on Indigenous communities, on making sure that we fully understood what was happening around BC beyond our first round of granting that happened in 2020. So with that all, we now have a couple years of data in BC, which is allowing us as a government task force to analyze it and now finalize our recommendation to the government, which hopefully will be usable across Canada for other jurisdictions and nationally to help us figure out how to really, change the dial on period poverty and menstrual equity issues.
Wow, thank you so much. I really like how you said back in when you started, you knew there was a problem, but you didn't know how to tell the story without the data. So I love that your success has come because you have data. Data speaks. Thank you so much. Okay, if we could go over to Veronica. Veronica, I wanted to ask you, what barriers to menstrual equality are created by a lack of data? We've just seen from Nikki, they've had amazing success because they had data. What have you seen are barriers that have come to your work because of a lack of data? And how might we ensure that the data captures menstrual equality considerations across different populations?
Absolutely. Thanks so much, Diana. I'm really happy to speak to the work that we've done and the data that we are able to collect over the years of working with Indigenous communities in the North. So first, I just do want to start off by saying that I'm a settler and I'm speaking to you today from Treaty 13 in Williams Treaty Territory, the traditional lands of the Anishinaabe Nations, the Haudenosaunee, the Huron-Wendat peoples. I honor the nations of these lands and the treaties that bind us together, as well as the Dish with One Spoon Wampum that speaks to protecting the lands and the waters around the Great Lakes, which is where Treaty 13 is. I live by the teachings of the Turo Wampum Belt and its lessons on living nation to nation. So I'm so grateful again to be here today and discuss the work that we've done alongside Indigenous communities, specifically in the North across Turtle Island. So for those of you who don't know, Moonshine Connections is an Indigenous-led period equity organization. We're supplying products and menstrual education to more than 150 Northern communities from coast to coast to coast. So I think in general, the lack of data itself is a barrier to menstrual equity. An understanding of the needs and experiences of any group is foundational to advocacy. So how can we meaningfully support and affect change without informed understanding of what change is needed? So we know of Plan Canada's Period Equity Survey and Nikki's surveys and all of that data collection. But really, what about Indigenous menstruators specifically in the North or other specific populations in Canada, like the Two-Spirit and the LGBTQ+ communities? We really don't have a lot of data in terms of those populations. So some of the same barriers affecting menstruators across the country are significantly amplified for Indigenous menstruators in the North, who then face additional unique barriers to access not found in urban areas, and yet no data is really there to support the need. So there are a number of reasons for this, one of them being lack of trust in data collection. You have to have a relationship with community in order for them to understand why you are asking them certain questions, or so that they see that it is holistic and not just extraction for data purpose, right? That data needs to go back and that support needs to go back to community. Around specifically reproductive health in Canada, there's been a lot of mistrust. So really trying to build that relationship is going to be key to reducing that barrier to collecting data. One way that we are able to understand the need in the North is through our request forms. And this is something that we didn't really realize we were doing as we were doing it. We've been doing request forms for 7 years now. So they give us insight into the unique needs and preferences of every community we work with. And then we use that data to inform our product distribution. Without this data, we could be providing products of absolutely no use to community. So this is not equity. We really want to send up the items that are requested. So we're often asked about sending menstrual cups from the community in the urbanized areas where we get our product collection from, as this is seen kind of like as a solution for period inequity. However, if we solely based our shipments on what we thought was best, then we wouldn't be supporting the community in a way that they wanted to be supported, which is very important. Assuming another person's solution to their need and acting on that without informed data is furthering a colonial concept of we know what is best for your community. And through our federally funded education and awareness program, thank you to Joanna, expansion, we connected with all of the communities that we work with to ask how we can support their menstrual education. And so through our poll, we were able to really deepen our understanding of the gaps within our current menstrual education program, and then use that information to build out our training program that is based from the information from community that will then go back to community. Knowing that there was a lack of data and awareness around period inequity in the North, we worked with the University of Saskatchewan to develop a survey that highlighted the experiences of Indigenous menstruators specifically to generate a better understanding of the unique challenges faced by these communities. Now, we're excited to be releasing the landmark report. It's addressed as an assessment of menstrual related needs in Northern communities next week, which is really exciting. And now, while our study confirmed exactly what we knew from our experiences and conversations of working with community for the last 7 years, we now have some concrete insight into the experience of Indigenous menstruators, specifically in the North. And it's a pivotal moment for our work, but it's also a pivotal moment for the period equity movement as a whole in this country. The results of this research have already been invaluable, painting a new picture of the gaps in access and education, including topics like period pain, which we really didn't realized was such a huge need for information. The study is already helping us reshape our approach to community support. So I think in general, and as an overall arching point, is that we really need thoughtful and culturally relevant research that is led by the people within their own communities. People that they trust, people that they know will bring that information and support back to their communities, not just extracting information and data and then saying goodbye. For Indigenous nations, Indigenous-led research is vital. And I know that the Canadian government just did a conference around and focused specifically on Indigenous data collection from Indigenous communities. And the same applies for Two-Spirit and LGBTQ plus menstruators, right? It needs to be community-led with deeply rooted relationships, and that will ensure that we are capturing what period equity looks like across diverse populations.
Wonderful. Gosh, Verona, thank you. I really, really like the point that you said. I'm going to ad lib, but that oftentimes there can be a mistrust because we're seen as just going and getting data, but we don't come back and show how that can help them. I think that's a question all of us doing research, are we getting the information and going back and showing how it's really helping that community? We need everybody, and we can't just take, we have to show that holistic approach. And also really quickly, I love that through the data, you're not making assumptions. Like I think so long we've in menstrual health just assume everybody wanted disposable pads. And now we're recognizing, people have lots of choices and we should not go in sharing that. So I love that through your data, you're really looking at different populations and not making assumptions, and then letting them have that trust that we need your help, and we're going to come back with that. Thank you so much. Okay, Dr. Lisa, our last panelist, she was really kind of spearheaded the Canada Menstrual Health Country Snapshot. From a research perspective, as you worked on Canada's Menstrual Health Country Snapshot, was there anything that surprised you about the data? Or was there a critical piece that you felt like, wow, I can't believe we haven't researched this yet in Canada? Or is there something that you felt while doing it that's really holding Canada back? If you could speak to that.
So much. Excuse me. And thank you to the organizers of this event. It's just such a pleasure to be here with all of you, with an amazing group of people. I'm joining you from the unceded ancestral lands of the Musqueam, Squamish, and Tsleil-Waututh peoples, also known as Vancouver. And while it's true that I perhaps spearheaded the snapshot, like all menstrual equity work, we worked together. We should always be approaching these projects as a team of diverse folks who are invested in insights and different working on. And when I think about the research that needs to happen and where I'd like to see the movement grow, this is definitely front of mind for me. And I come to this work as an educator. That's what I spend a lot of my time doing, working with young people, mature students, folks from life who are excited to learn about things so that they can move their life forward. But I'm also a researcher, and specifically an academic researcher in the social sciences. And I think there's a lot of things that we associate with academic research and what academics do. For me, I'm really invested in learning more about the political and social aspects of menstruation through research. So that's really my area. And much of my role, while it does involve doing research, is also about supporting students in their learning, potentially supporting students to be involved in research, integrating the work and research that I do into my teaching, also using my role as an academic to support the work that's happening in community. And I just think this is such an important role that academics need to have and should have, in understanding the impact that research can have on movements like menstrual equity, but also related movements connected to sexual and reproductive health more broadly. We've seen so many changes in Canada so quickly, especially on the policy landscape, but we absolutely need more research. And so when I'm thinking about barriers to the movement moving forward, my hope is that the research that is happening is amplified. Like, for example, Veronica and her team's amazing report is the first of its kind in Canada. Like, the importance of that research just can't be understated. And we absolutely need more diverse kinds of people involved in designing and informing research as the movement begins to grow. In the Canadian context, another thing that we've seen is that grassroots activist community organizations and key not-for-profit organizations like the United Way and Nikki Hill, again, has been a really important leader in this regard, have played a truly vital role in not just taking action to support menstrual menstruators, but also bringing the menstrual cycle onto the policy agenda through the use of research through data. And one of the things that we've seen is that many groups are filling in the research gap as they're going, sometimes with funding, but often without. And I can't tell you how many stories I've heard through research, also through conversations with people in the Canadian context where they're saying, you know, somebody said to me, show me the data. And so they said, I'll go get you that data. And I think this is really powerful and shows the commitment of folks in the Canadian context, but also around the world. I think it's a common story. At the same time, I would like us to shift that story. I think people should be well-resourced when they're carrying out research because it's a significant time commitment. And in order to get good intersectional data, both from a qualitative perspective, but also disaggregated data where you can see those complexities at a bigger scale, people need to be well-resourced and adequately resourced to do it in a good way. What I see are nothing but possibilities, so I hope the barriers are not there, but a couple key areas that I see in this is in part in the snapshot in just a small way, but also in other that we need to start thinking beyond blood. So this is where a lot of folks enter into these discussions, is the need to get people emergency menstrual supplies, which again is so important. So we think this is a really important point. At the same time, exactly as Veronica's mentioned, right, this is more than blood. It's about pain. The menstrual cycle impacts the life course from puberty up until menopause and even into postmenopause. So this is really full body experience and one that impacts people in a diversity of ways. So we need more research that tells us about diverse experiences. In Canada specifically, there are so many differences between spaces. I loved how Joanna said knitting. That's such a beautiful and gentle way of talking about the connection between us all while still recognizing the incredible diversity within spaces. When I think about that need for regionally specific, for sure about the unique needs of administrators in those spaces, but also the ways that people have pushed for or advocated for change at the policy level, if that makes sense. Right. So what does it mean to advocate for policy within the context of Victoria versus perhaps Moncton, right? What are the unique challenges of advocates and activists in those contexts, and what can we learn from those stories? Finally, and for me, perhaps most importantly, we need research that works with and alongside grassroots and community activists and organizations, build capacity over time for a movement that is sustainable, but also really centered on sustainability in a broad fashion in ways that are connected to the needs of local communities and contexts. And there are several really powerful examples of this kind of approach. For example, the pilot projects model that Nikki mentioned that was funded by the government of British Columbia. This model really placed community organizations in the driver's seat in terms of how programs were structured, but also allowed them considerable latitude in terms of how data was gathered from their community members. And several groups took considerable time to consider innovative approaches, not just to product distribution, but also in terms of how data was gathered from community. Engaging, for example, elders and knowledge keepers, but also youth in terms of design, how research would be shared back to community. So what I see is exciting opportunities for partnerships that can lead research, which will support absolutely evidence-based decision-making and program development, but going back to community and putting that first. I want to conclude by saying that academics in general are late to the period party. And so I really hope that the story that's told is not like we're here, this movement belongs to us, because I do think there's a tendency in academic to behave in that way. And I think that would not just be a missed opportunity, but a real problem. And so I certainly hope that as academic researchers start to join this conversation, that we're really putting first the kind of knowledge gathering and sharing that's supportive, not just of the needs of menstruators, but also the people who have built this movement and got it to where it is, and ensuring that the knowledge goes back to community and those folks in a meaningful way.
Thank you so much, Dr. Lisa. It feels like one of the themes that's come out from this is really almost like what we were talking about with Joanna, how we need private and public sector to come together for funding. We also need the academics and grassroots to come together, right? Everybody brings a lens and expertise that is needed. And I really like when you said one of the positives about the MEF, it was that people were given the latitude to collect the data, to work with the grassroots, to get that information in a way that's culturally appropriate, but can also be used across Canada. And again, we just cannot, one other point that I thought that was really good that you said was how we need more funding, right? Research is something that we need more funding to good research. And I wish we could solve that problem today. But anyway, because data speaks. Okay, so just quickly, I know I'm just going to do this off the top of your head. You know, with Menstrual Hygiene Day coming up, it's been 10 years. We're reflecting on what's happening from where each of you sit with your expertise and your unique perspective. Could you, in 30 seconds, just share, if you had one wish for Canada, maybe for research or for menstrual equity, what would you wish in the next 5 to 10 years that you'd really like to see? I'll go ahead and start with you, Dr. Lisa, because you went last, and then we'll just go immediately. Let's go to Nikki, and then we'll go to Veronica. So if you could each answer that question, just 30 seconds.
Absolutely. Yeah, we need more research. We need research that's funded. And I was really excited to read the report. Let's talk about it, period, from the Standing Committee on the Status of Women. It's a fantastic report. I encourage everyone to read it. And I think it really reflects the robust approach that's been taken by Women in Gender Equality Canada. Just, again, cannot be understated. Recommendation 11 reads, we need more research. I'm just going to make that brief. And then if I'm going to sneak in one more, we need more opportunities for connections like this. So it's really great to have events like this for us to gather and share our knowledge back with each other.
Perfect. Okay, Nikki?
Yeah, so I think it's actually more research, but better coordination, less duplication. I think, like, sort of as Dr. Smith says, lots of folks are, starting to come into the picture, and that's great. And we need the data, but we don't need the duplication, because we need to have a robust set of principles and data that allow us to put the whole picture together and come up with the solutions. So great to see all of this work, but let's do it together and coordinate better.
And just to add to that, I would say, Nikki, from a point someone else said, and how telling the world about the research. A lot of people are doing research, but we're not having access to it. So that would be another one. Okay, over to Veronica.
Yeah, I think definitely bringing Indigenous voices to this conversation is very, very, very important. And looking at access to the North, building that trust again around reproductive health is very, very, very important. And traditional knowledge around different oral traditions, around moontime, around that knowledge that has been impacted by Indian residential schools, and that kind of shame that the elders and knowledge keepers and that kind of older generation feel around talking about that traditional knowledge that was kind of supposed to be suppressed. So really just revitalizing that, loving to see elders and youth speak about those traditional teachings, about traditional medicines, and the holistic approach to menstruation from birth to death.
Thank you. I really like that. I think that's right. That's a balance, is as we go in and we bring our menstrual health education into communities, to respect that they have a lot of great things already happening, and to include those in, and not just write off the cultural traditions that are healthy and a part of that culture. I really like that. Okay, so quickly we're going to go to, we could have another whole webinar on research and data and the importance. We hope that we are spurring ideas on people who are advocates in this field, and researchers and stakeholders to know data speaks. We need it. Now we're going to go to the next section of our webinar, which is what comes next. We've had just so much information given. We want to talk about what are some actionable paths towards menstrual and gender equity. As we met those of us that were organizing, we thought, people are calling in from all over the world, and we want to learn from Canada. And I feel like we've already learned a lot, but are there some tangible things that people can do when they leave this to help further menstrual equity and gender equality in their communities. And that's what we want to focus on. So the next part, Jillian Johnson was going to present this, but she was not able to be here. So we're really grateful that Jess Straight could jump in. Jess serves as the advocacy specialist and data systems manager for Days for Girls and is my colleague. In her dual role, she supports the upskilling of advocacy volunteers in high-income countries. She oversees student and youth programs and implements efficient IT systems to propel our organization toward data-driven decision-making. And then we're going to have Megan White, who those of you in Canada are familiar with her. She's the digital marketing manager at Women's Global Health Innovations and the founder of the national nonprofit Period PACS. Additionally, she serves on the board of the National Goucher Foundation of Canada, and it is an advisory member to FEMADA, I hope I said that right, a women's pain clinic contributing to nationwide healthcare access and equity efforts. So Jess, if you could tell us a tangible way we could create more equitable spaces at work, we'll turn the time over to you.
Thank you so much, and happy International Women's Day a little bit early for everyone. Depending on your time zone, maybe you're almost there. So I'm excited to share about the Period Positive Workplace Initiative, just as one example of a step that's been taken both in Canada and globally. The Period Positive Workplace is a global movement to activate the private sector to take action for menstrual equity. So through a free certification, organizations can then stand up as a leader in the movement while promoting a more inclusive, gender equitable workplace. To become a period positive workplace, organizations do three things. The first is provide period products in every bathroom used by people with periods, from the C-suite to the warehouse and everything in between. Secondly, they meet the WHO's water, sanitation, and hygiene standards. So their bathrooms must have clean water, soap or sanitizer, toilet paper, and a waste bin. And then finally, period positive workplaces commit to long-term sustainable implementation of menstrual health care in their businesses. They must give a formal notice to employees that period products are being provided and will continue to be provided. And that's it. So it's a really simple initiative, but we've seen amazing growth. We've had 130 businesses certified in less than a year and 144,000 employees impacted. The period positive workplace was really sparked by this idea of setting a new precedent. And that precedent is that menstrual care needs will be met in all restrooms. So the same way we can expect to see toilet paper, we want to expect to see period products. And so with the provision of menstrual products in federally regulated buildings in Canada, the next step is then, can we engage our own employers and businesses in our lives to do that same thing, to become leaders for menstrual equity advancement while creating supportive work environments for the women that they employ. And we do have data supporting this thesis of the period positive workplace and that role of menstrual health at work. Research from USAID demonstrates that workplaces providing period products will see reduced absenteeism and increased productivity among people who menstruate. And that same report shows that companies that invest in menstrual health will see benefits worth more than 2 times the cost. Menstrual health provisions have been shown to make good business sense. Employees will feel more welcome in the workplace, they're more likely to contribute to teams, and they're better able to focus. And then a customer is able to enjoy their experience, knowing that that business has their needs in mind. So from what we've seen with almost a year of talking to business owners about this initiative, for a lot of organizations, this is almost a no-brainer. We've had major corporations and small businesses from 34 countries in every inhabited continent joining this conversation about menstruation at work. And when the topic is brought up, a lot will say something like, we just hadn't thought about it. We hadn't considered this was a need in our workplace. And so as businesses are making efforts to support women at work, the relatively small change of providing period products has been shown to have a big impact. And so you can learn more about the initiative and get involved at periodpositiveworkplace.org. But as Canada has led really this transformation of what a public bathroom looks like, we want to see that same shift carry on at a global level by creating these period positive workplaces. Thank you very much, and let me know if you have any questions.
Thanks so much, Jess. I think Sarah just dropped the link in there, and that is one thing everyone can go do right now. Get your boss or your workplace to become period positive workplace. And by the way, we just gathered some data that we'll be releasing in May of the organizations and businesses that have joined. We got their data back. So data speaks, as we're talking about, and we'll be sharing that in the next few weeks. Okay, Megan, we'd like to turn the time over to you to emphasize, what are some other actionable paths forward that you can see?
Yeah, thank you so much. I mean, this is a lot to follow up, so I guess I will be a bit brief so we don't duplicate information and we can get to the exciting Q&A portion. But I do want to touch on, Jess, what you just said about engaging your own employer and kind of the concept of a community ecosystem, and the pay it forward kind of connection that we all have when someone gets a pad or a tampon, and what that can look like for the entire community. We've talked about a lot of high level stuff here, about positive storytelling, about communication, about not duplicating services. And I think this is a perfect example of all of those things. I've sat in this digital room with a lot of people who are here today many, many times, but it's been quite a few years. And it's so exciting to see where we were and where we've gotten in that short amount of time. And by having events like this, we're really addressing a lot of the problems that we just talked about duplicating services, about misunderstanding where are the holes, where are we not filling in what we need to do, and by coming together globally. I know there's a lot of international folks here as well today, but as well locally here in Canada, this is making a huge difference. I want to touch on the importance of positivity in advocacy, both for new advocates that are here as well as for seasoned advocates. There is a reminder here for seasoned advocates to keep your stories positive and inspiring, so that we can encourage the next generation and group of people to pick up the torch and do the same work, as well as get community buy-in and social buy-in from all of the stakeholders that we're working with, especially when we're talking about policy change and telling a story to folks who might only have 30 seconds, 60 seconds to chat with you. And I think it's really important to remember to not let perfectionism get in the way of change and not be the enemy of change, because it's really easy to say, oh, we have so much further to go, which we do. And there is a remarkable sense of urgency when it comes to problems like this that are so foundational to addressing menstrual equity. But we also have to remember how far we have come. And I commend everybody in the room here, digital room, today for doing that. So I'll just say a couple things really quickly about, of course, we've already touched on it, but comprehensive menstrual health education. And that doesn't have to always look like creating booklets and distributing them. It can also look like mentorship. So I didn't hear a lot of chat about youth here today, which I think we can all agree is foundational to this movement and foundational to just solving community issues and solving community problems. So Lisa, you did touch on the importance of mentorship for your students and in academia, but I want to remind everybody that simply reaching out to young people, talking to them about periods, telling them your story, and becoming an accessible advocate helps move this movement forward. I know we're all on LinkedIn, but if we can get to the youth and get a little lower down there and get to people outside of our age kind of cohort, we'll be better for it, and so will the movement. And that is a huge part of challenging stigmas, which is another thing that I really wanted to talk about. And of course, everybody here knows that we need to do that, but I just wanted to circle back to using youth as a channel to challenging stigma, because it's foundational. It's where your period starts. It's the first interaction that they're having with their period, and it's going to last, like we've all talked about quite a bit here, for your entire life cycle. So I think the things I want to emphasize the most are stigma reduction through engagement with people in different age cohorts, and we just haven't chatted too much about that. The community ecosystem, and that kind of comes back to engaging youth as well, remaining positive while we move this forward, because it can be a slow needle. It can feel like it drags on, but we are making amazing headway. We heard from incredible leaders here today, and we know that to be true. And engage on a local level for policy change and reform. Letter writing campaigns work. They really do. Emails work, LinkedIn reach out work. We do it in our professional lives, cold calling, cold reach out, and it has results. It's a whole strategy. And I think people forget it sometimes when it comes to advocacy. They feel very disconnected from community leaders and policymakers. But I can tell you with my experience, period packs, and I know many people in this room can echo the same thing, that cold calls work when it comes to advocacy. And lastly, I'll just say that we desperately need to engage non-menstruators as well in this whole story. And I'll circle back to youth, especially at a very young age, so that we can all become advocates.
Thank you. Wow. I'm going to move on, because every point exclamation point behind. Very good. So to bring us to the end, before we get to our questions, Adrian has a big task with his closing remarks, but we're really excited to have Adrian Dongas here with us. He works at the Sanitation Hygiene Fund, leading the development of a global menstrual health and hygiene strategy to realize the fund's vision of transforming the way people access menstrual products through markets across low to mid-income countries. In previous roles, he's fulfilled a senior leadership position in a leading menstrual product company and led UN-wide efforts to mainstream menstrual health and hygiene. So Adrian, we'll turn the closing remarks over to you.
Thank you very much, Diana. And it's no easy task, especially given that we're a little bit over time. I don't want to take too much time away from the many burning questions in the room. So let me just quickly start by saying that I think it's quite phenomenal to see how the Canadian government sets an example of what a long-term commitment to the topic of menstruation can actually yield from all the different stakeholders that were in the room today, sharing the different initiatives that have come out of long-term investment, both in terms of time and resources to this topic, both domestically and internationally. So I think that's definitely worth an applause and sets an example for what some countries have tried to do and what other countries should be doing in the future to make sure we can progress, not just in Canada, but around the world. As the UN Sanitation and Hygiene Fund, that's something that's very close to our heart. And obviously our focus is very much on people who menstruate living in low and middle income countries. As Tanya summarized very well, I think there was at the beginning a really important point of how the Canadian government was at the center of progressing the innovations in menstrual products, what we've seen over the last decade and a half. And it's really set us up to potential success for a new era of providing access to products. We've seen that in many low and middle income countries, there's been a lot of progress in the areas of policy, integration of menstruation into national curricula, even countries that have progressed in the area of product standard development. And those are all very promising developments that have taken place that show us there are structural solutions to address the issues of stigma, lack of information, misinformation, and ensuring that people feel comfortable about their menstruation, that their family, their friends, everyone is aware of what menstruation is and how we can support. And there is one outlier, it seems, for quite a long time. Many people have said on this call today, rightly so, menstruation is so much more than just a product. But we haven't really formulated an answer to what a structural solution to product access is. Yet this is a massive gaping hole in the world when it comes to the demand and the need for these products and what people currently have at their disposal. We're talking roughly 500 million people around the world that can't access products to date. In the current funding landscape, we do not expect to see wide-scale availability of free products for these populations. I spent most of last week working with Nigerian government officials and people within the institutions trying to figure out what that could look like. And that would be an envelope of $1.5 billion annually just to fill that gap for one country in sub-Saharan Africa. And that means that we need to have a switch in the way that we look at providing structural access to menstrual products for these populations. And that is something we can truly only achieve if we improve the way that our markets work, to make sure that markets like the Swiss market where I'm based, or the Canadian markets where people have a variety of options at their disposal through pharmacies, shops, and other places, to also make sure that these options become available in low middle income countries. There are many examples on today's call, from Bfree Cup and many others that have tried to do that in different ways. And let me just share 3 small buckets that I think we should all be paying attention to. Let's make sure that we look at the regulatory environment and help support national governments across LMICs to make sure that they strengthen the regulatory landscape of product standards that facilitate both the movement of goods, the entry of goods, as well as the quality available to end users. This is a major barrier to market development to date. That we make sure that menstrual products, both in its finished form as well as the raw materials that we use to make them, are taxed at the port of entry and at the point of sale in the categories that they should be taxed as, which is a basic necessity, not a luxury item. Then support private sector to develop the right business models that allow us to bring these products to the last mile in a way that is cost effective and sustainable. And finally, ensure that there are very clear financing strategies that provide targeted public sector funding to help bring solutions to scale, and then de-risk financing and investment from the private sector so that ultimately we can really catalyze the small amount of grant funding that is available to help scale these initiatives and provide a structural change to the way that people access menstrual products across LMICs. I'm going to stop here. I'm going to hand over to questions. If people want to know more about the work that SHF does, reach out to me. If you want to know more about market-based approaches, you can also reach out to the Menstrual Health Supplies Workstream and to Tanya. Thank you so much for your time. Thank you for organizing this event, and I look forward to continuing this conversation.
Thank you so much, Adrian. I hope a few questions get sent your way about the market orientation approach. I think that we do have to have a switch in the way that we've been doing things. So I'm going to turn the time over to Megan to answer what the last, 6 minutes of questions that we have. So over to you, Megan, to lead that. Megan, are you? Oh, there you go. Okay.
Oh, I don't know how that happened. Sorry, everybody. Excuse me. I'll just get right into the question then. So, Joanna, I want to ask you something, Joanna from Wage, about the private sector participation and what was behind that decision making, and additionally, what was behind the decision making to do this at all? So, what went from grassroots advocacy to someone in your office saying, you know what, this is a program we need to pay attention to, and this is something we need to look into, to $25 million?
Okay, thank you. That's a great question. And it actually does have a really innocent answer around, it literally showed up in a mandate letter for a minister. And that's what I said in my remarks. And so it was, honestly, you can only imagine that it was the tireless work of people like yourselves who had been at the right tables, who had been talking to the right folks, who had put the right research in front of people. Obviously, our government is really interested in what I love Adrian's phrase around bringing products to the last mile. Like, who are the Canadians that are not accessing these products, and why are they not accessing them, and what can we do about them, was, I think, the question at hand. And I think government realized that this was a scope and scale of a problem that we should really dig into, and that we should use what we already have at our disposal, which is a vibrant community looking at this issue, talk to them first and see what direction to head into. So it was a bit of a case of a slow and steady advocacy effort, which led to a focus on a very specific social issue, which seemed within the wage context, especially because we're so interested in intersectionality. We're so interested in systemic change. We're so interested in reducing barriers and making sure that we are solving systemic issues once and for all, that it just seemed like a good issue to move forward, is my sort of very, I suppose, personal answer to your question. But Megan, there was no big fireworks. It was really a moment of the stars aligned, and we got this in our mandate letter. And of course, we had a minister and a parliamentary secretary who was very interested in moving this along. And we had the public service who was ready and poised to take on the work. So that's all I can say. Yeah.
No, that's really insightful, and thanks for shedding more light on that and demystifying the process. And I think it speaks to what everybody here is saying, and that local leaders are really best positioned to change. And that's a quote directly from you, Diana, that you said at the beginning of the webinar. Thank you so much. I'm going to go now just to pull a question here. Wendy, you've been really active in the chat. Maybe I can ask one of your questions, if I may. Excuse me. Share lessons learned. Okay, yeah. I think, Nikki, you've already addressed this, so we can move to something else. Excuse me. So I want to ask a quick question to Christina from FIT, and I'm wondering if you can shed a little bit of light on the criteria you look at specifically when funding menstrual health initiatives.
Sorry. Hi, Megan. Well, our program's a little bit broader. Obviously, maybe you got that from the other speakers as well. So I think the main components we're looking at, like, we are looking to fund innovative solutions that are driven locally by grassroots organizations in countries in the global south, but also with their Canadian partners. And so what we're trying to understand is whether or not these ideas have been tried before or if they're new to these contexts. So in a general sense, so we try and choose the projects or the proposals that come up that seem to have that are the most interesting and seem to be the most innovative for the context that they're in. So that's sort of the approach we take, and that's allowed us to support a range of projects, but also some that address menstrual health and menstrual hygiene, and also WASH, et cetera. So we've kept it open on purpose, but with the full intention of supporting projects that could be very innovative for the context where they're working.
Thank you so much. That's very interesting. And it's nice to know that it's a broader kind of open concept application. So anyone coming up with innovative solutions to address menstrual equity or period poverty would be able to apply. That's fantastic. And I do want to circle back to Diana. You made a good point. We should chat a little bit about that market-based approach that Adrian brought up. And I'm wondering if you could elaborate on that a little bit for us.
Yes, happy to. So basically what we see is that the reality is that in many countries, we have a lack of availability of the product innovations that we find in high-income countries. And this is a bit of a strange situation, right? So really, period poverty in a country like Nigeria or Kenya is just poverty. I have $100 a month to spend on all my essential expenditures, from my rent to the school fees for my daughter, to the food and the essential medication that I need. Menstrual products are just one of that, and I don't have enough to cover all those bases. At the same time, in these markets, only the most expensive product category is available. So a menstrual product that is available in the market widely is just a single-use pad, costing you between $20 to $30 per user per year. Yet solutions like menstrual cups, reusable pads are not widely available, even though they could be up to 15 times more affordable over the lifetime of a product. So why are they not in supermarkets? Why are they not in pharmacies? What are the things in the market that are preventing these products from becoming widely available? As I tried to touch upon earlier, there are issues related to regulation that play a key role. But I think one of the most difficult things that we haven't yet overcome are two. One is developing the right business models that are completely cost recovering to be able to sell a product to the end user without your company collapsing. We don't have hundreds of millions of dollars to push this through the supply chain the same way we do for family planning commodities like contraceptives, IUDs, and other items. So it has to be able, a company has to be able to recover all of its costs as they bring the product to the user. And the big difference here is that we are no longer dealing with fast-moving consumer goods. So far, all of our efforts have been, let's try to mimic P&G, let's try to mimic Always, who have much larger budgets because, one, the volume of their market is bigger, as well as the overall budget that they have per user for the cost of acquisition of a customer. So we need to start looking at models for slow-moving consumer goods. Where do these products move to markets? How do people access, for example, an energy-efficient cook stove in a country like Kenya? Where do you get all your essential healthcare products in a country like Uganda? Can we leverage pharmacy supply chains and networks to bring these products to end users? Finding that right business model that allows everybody along that supply chain to earn a fraction on the cost of the product will get us a long way. But then the secondary and much harder question is, how do we ensure user education and demand generation for these same products and still be able to capture that within the cost of the product? These, I think, are the two hardest challenges that we are trying to overcome. And we've seen too few companies that have attempted to develop these models. And it's not to their own fault, because right now, these markets don't have enough incentive and not enough financing to do that. If you talk to Bfree here on the line, if you talk to a company like AfriPads, if you talk to B-Girl and so many others who've been trying to do this for many, many years, the viable business model is still selling to NGOs, selling to governments or UN agencies who hand out the product for free. And we need to work with companies to learn how we can sell to the end user. How can we convince a woman in a country from, pulling her wallet and spending her money on a product that she's never seen before? How do we gain her trust? How do we help her to overcome the upfront cost of some of these products? And how can we bring the price point down in general to make these products more approachable? There comes a huge opportunity with that. This is a market of 800 million people today that is already willing and able to afford a reusable product. They're just not in a position to make an informed decision and then take a bike, go walking, or take a bus to get to a shop within half an hour to buy that product off the shelf. So they're not in that position. But if I would tell an investor, and I've told many, if you're talking about a market where half the population for 35 years of their life is going to be menstruating, these are the youngest populations in the world, the fastest growing populations in the world, with the fastest increase in purchasing power, you would assume we can bring private money into this. Now, this is not a game of let's see how much profit we can make, but if we can make menstrual health investable, then we can leverage private money to really bring this to scale, because we can no longer afford to continue down the same route of trying what we can through donations to help the few that we can reach. Now we need to think about how can we radically and structurally change the way this market operates, that in 10 years from now, we will ensure that not 40%, but 80% of people in Nigeria, for example, have access to a product through the market, and we can focus our efforts on the remaining 20% with targeted support through subsidies or other mechanisms. It's quite a complex issue. There's a lot of work that's going on within this. Again, I'll refer to the RHSC Menstrual Health Supplies workstream for those who are interested, and we are available to discuss more. But this is really one concept that needs much more unpacking, and where funders like the SHF, government funders as well, can come together and really drive that public investment case.
Megan, if you don't mind, I'll jump in because of time. But Adrian, I think we just have our next webinar set right there, just on everything you said. It was excellent. Because of time, everyone's been saying well said. And so I just want to thank so much our participants today for sharing their insights. I think all of us have come away with a lot of rich information that we can take back to our advocacy work, especially this end note from Adrian. You know, as we go into International Women's Day tomorrow, I just think again that this theme has really resonated as we look at the work that Canada's done, that we need to invest in women to accelerate progress. So we wish you all a wonderful International Women's Day tomorrow. Please be watching. We will share the recording for this, as well as many resources that were mentioned will come, and then look for a webinar report in the next few weeks. But a huge thank you again. I can't believe everyone hung on for 90 minutes. Really a rich discussion, and we will have to talk to Adrian about having another webinar on his topic. So thank you so much, and all of Canada, thank you for setting the way and helping us learn from all that you're doing. And everyone, have a great afternoon, evening, or morning, wherever you're at. Thanks so much.
Thank you so much, everybody. Happy International Women's Day.